It looks like we're live. All right. Well, thank you everyone for tuning in. My name is Justin Hodge, and I'm the Washtenaw County Commissioner for District 5, and I'm also the chair of our Board of Health. We've been living with COVID for almost 2 years now. For our community and communities across the state and around the world, it's been an extremely hard 2 years. We've lost far too many loved ones and have had to deal with the stress and uncertainty that comes with an unprecedented pandemic. While these 2 years have been tough, the Washtenaw County Health Department, the Office of Community and Economic Development, the Racial Equity Office, and the Washtenaw County government as a whole have been working hard with our local healthcare systems, community organizations, and community leaders to keep people safe and healthy, while also trying to respond to long-standing inequities that have led to certain communities being hit harder than others. While we continue to work on some of those bigger systems changes, tonight we want to talk specifically about staying safe and healthy. Because during these 2 years, we've learned a lot about social distancing, mask wearing, vaccines, quarantining, and more. And sometimes it's hard to keep track of all that information. So tonight, I'm honored to join our health department leaders, Jimena, Loveluck, and Juan, Marquez, to give an update on where we currently are in the COVID-19 pandemic in Washtenaw County and help answer some of those questions. I'm going to turn it over to you now, Jimena.
Thanks so much, Commissioner Hodge, and good evening, everyone. Again, my name is Jimena Loveluck. I'm the health officer with the Washtenaw County Health Department. Thank you so much for joining us tonight for this Facebook Live event so we can answer your questions and hopefully share some important information that really has led us to issue the public health advisory that went out last Friday. As Commissioner Hodge mentioned, we recognize that this has been a long time of dealing with COVID. And we at the health department have been working so hard to keep everyone as safe as possible. And we know that at times it's been frustrating as guidance has changed and information has changed. But our role is really to make sure that you have the most updated, accurate information to help you and your loved ones stay as safe as possible. And while it's really hard to be in this latest surge with Omicron, it is important to recognize that as we start 2022, we are in a different place than when the pandemic started. We have safe and effective vaccines that were not available at the beginning of the pandemic. So those continue to prove very effective in preventing hospitalizations, severe outcomes, and even deaths. And so we have to recognize that we certainly know more. We have more treatments that are available, including monoclonal antibody therapy and antivirals, which Dr. Marquez will talk about later in this event. And so it's important to remember that in addition to all of the recommendations around prevention and strategies, mitigation strategies that we've been sharing all along, we have these additional tools that are so important in protecting our health and well-being. So as I mentioned, vaccines, we continue to work very hard in promoting vaccination. And we know that everyone 5 years and older is eligible to get vaccinated now and should be vaccinated to protect themselves from serious impacts of COVID. And additionally, more and more people are eligible for boosters, including everyone 12 and up. In Washtenaw County, we are so thankful for our high vaccination rates. Nearly 70% of our residents 5 years and older are fully vaccinated. Over 68% of our residents who are 65 years of age and older have already gotten their boosters. And we are leading the state with our vaccination rate for kids. Over 53% of children 5 to 11 have gotten at least one dose of COVID-19 vaccines in Washtenaw County. And again, you can find appointments available for children and adults on our website. And you can make appointments directly through the link that you find on the website. If you need telephone assistance, you can call the health department and get assistance in making an appointment or getting more information about vaccination. We're about to enter the third year of the pandemic, and our public health workers have been working incredibly hard. And truthfully, we have been overwhelmed for quite some time. So in issuing the public health advisory on Friday, it really was a way to remind all of us that we need to continue to do our part in protecting ourselves and our loved ones in our community. We want to make sure that we continue to promote vaccination and encourage those who have not gotten vaccinated to get vaccinated, to get your booster if you're eligible. The importance of wearing a well-fitting mask in any indoor public space, including even if you have been vaccinated and are up to date with all your vaccinations. The importance of getting tested if you feel ill or have been exposed to COVID-19, and understanding what you should do if you test positive or you're a close contact. And we'll talk more about that during the event. And if you're feeling ill, stay away from others, especially if you're waiting for a test result or have tested positive. Avoiding crowded areas and limiting gatherings, and making sure that if you are in a gathering, you're doing everything you can to make that as safe as possible by wearing well-fitting masks, thinking about ventilation, and really ensuring that you're protecting anyone who is immunocompromised or more vulnerable that you're around. And of course, as always, cleaning hands frequently. So we're here to answer your questions and hope that we can share helpful information that will help you and your family and loved ones stay safe. So thank you again for joining us tonight. And I will turn it over to Dr. Marquez to make some comments.
Thanks, Jimena. Thanks, Justin. So, I would just echo what Jimena has mentioned, that really we're in a, it seems like we're in the same place as last year, but we actually are in a very different place where we have more tools available, both sort of for prevention, for early treatment, and so for treatment in the hospital, right? So as Jimena mentioned, we have very effective vaccines, right? We have a better understanding of the scheduling of the frequency of these vaccines, and a much, I would say, especially compared to this time last year, much more access to vaccines, right? So that's a really important tool we just didn't have before. Testing, so I think that, we're also a different place with testing. I understand that, there are limitations with testing, right? I think everybody feels this, as certainly when we've gone to the stores to try to buy over-the-counter antigen test, we certainly understand there's limitations. And I think that there's many efforts being done locally, the state and nationally, to increase the amount of testing available. But we're in a very different place than we were last year. So over-the-counter rapid antigen testing are available. That was not available last year. And there are also multiple different sites where you can get a PCR test within 24 to 48 hours. Again, something that we started to have last year, but certainly not as readily available as we now have. We also have, I think, some more treatments for early COVID, right? So one of them is monoclonal antibodies, that are very effective against Omicron. And we also have oral antiviral therapeutics that you can actually have prescribed for you if you meet the classification. Again, this is not to say that, that it's widely available. It's not to say that, anybody can get it right now, because the truth of the matter is that these are early therapeutics, and as they're rolling out more and more, as distributing more and more, it's going to become available, but it is in limited quantity right now. But for those who are at highest risk, these early therapeutics really are available for those folks to keep them out of the hospital. And again, we've also understood how to treat folks once they've been hospitalized and keep people from having severe complications of COVID-19. So really, I understand that that there's frustrations all around, both at the health department and the public, in terms of some limitations in testing and certainly some limitations in oral therapeutics. But I think that when you compare where we are now versus last year, we are in a very different place. And hopefully, as we get more availability for rapid antigen testing, as well as more availability for therapeutics, we'll be in a different place in 3 months, 6 months from where we are now. And I think just a few places, one of the sites that I did want to talk about that just is available is there's a new testing site actually that is over at the old Walmart parking lot in Ypsilanti. And so we have partnered with Lynx Diagnostics to open up this testing site to make it more available. I think people may be familiar with the site over on over on the west side of Ann Arbor. And so this is another location that's been opened up in order to increase access to testing, because again, we understand the importance of that. And as Jimena and just mentioned, we'll touch upon a number of other topics over the course of the Facebook Live.
All right, so it looks like we're about to jump into some questions. I do want to say thank you for mentioning Links DX. That location is in my district, and I'm very grateful for them locating there and working so hard for the residents of our county and the residents of my district. So the health department solicited questions prior to our Facebook Live, so we're going to start with those. But if you're joining us right now, please feel free to leave any questions or comments in the chat, and we're going to get to as many of these as we can. So first, we're going to jump into a conversation about masks. So if you've been following the news, you might be a little bit confused because guidance around masking has changed a bit. So what kind of mask should we all be wearing now?
So I'll just start, and Dr. Marquez, please feel free to add anything I might leave out. But yes, so CDC updated their guidance recently, and obviously that information is available on our website. With the even more highly variant Omicron, Delta was much more transmissible, and now Omicron is even more transmissible. It's become evident that it is really important to wear a well-fitting mask, and that for the most protection, it's probably a good idea to think about upgrading your mask. Now, that doesn't mean that cloth masks should be thrown out or not used, but we have strategies to either upgrade the mask to a KN95, an N95, or to double up masks, like wearing a surgical mask under your cloth mask. It's important that it be multiple layers, and that's what we're trying to do by upgrading masks, multiple layers and well-fitting masks. So that's one of the reasons that we at the health department, along with the racial equity office, are doing everything we can to get supplies out to community members who may not have access to KN95s. We've been distributing those over the past week or so. But again, even if you don't have a KN95, a surgical mask over a cloth mask or doubled up masks are still incredibly important to use. And as I said, when I opened in my statements, we do recommend that everyone, regardless of vaccination status, wear a mask in indoor public places.
Okay, so speaking of KN95s, do we have any available?
So at this time, we've distributed our supply. I know that the Racial Equity Office is working diligently to get more. We also are hoping to get more from the state as well. And so as soon as we're able to distribute more, we'll have that information available. But we did work, the health department at least has distributed close to 40,000 masks in the last week. And I know that the Racial Equity Office has distributed even more than that to community organizations and groups.
Yep, and I would echo one of the points that Jimena made just a bit ago, that even if you right now don't have access to N95 or KN95 mask, there's strategies to make your existing mask more essentially a better layer of protection, right? So one of them, like Jimena mentioned, is really double layering, putting your surgical mask underneath your cloth mask. And another actually very straightforward and simple strategy is actually tying a knot behind your surgical mask. So you make it a little bit tighter, and you kind of prevent all the gaps of air going around. So even if you don't have a K95 mask readily available, there are strategies using your sort of existing mask that will keep you safe.
I gotta say, I've been very impressed with the team and how effectively we've gotten masks out into the community. I've heard that since the beginning of the pandemic, the county government as a whole has distributed more than 1 million masks in the community. And we don't plan on stopping. Once we get some more, we'll be able to do that. To the points about making sure that you're wearing a well-fitting mask, the health department has put out a great infographic about that. So that might appear in the chat now that I've mentioned it. I don't know, but I know it's on the health department's page. So there's a really easy to follow. Here's how you wear the mask and make sure it's fitting appropriately. Okay, so let's move on. So now we're going to move on into isolation and quarantine guidance questions. So what should we do, or what should you do if you test positive?
Yep, I can start with this one. So if you test positive, the first thing to do is actually to isolate, right? So what does isolation mean? It's if you look at what the definition of isolation is basically keeping somebody who's sick or ill away from healthy folks, right? So that's just in plain terms what isolation means. So you should really isolate yourself if you test positive. But even before that, so if you're feeling ill and you go get tested, you should actually isolate from the time that you're feeling sick, right? So as you're waiting for your test results, if you're feeling ill, you should actually already be in isolation, so to prevent exposure of other people, right? So you would isolate yourself, and the time frame that we would ask for you to isolate would be 5 days at home. So it would be 5 days of home isolation, and that really means if you live with others, staying in your room or your area away from others. If you do have to sort of be in a common space, just to come in and out or go to use the restroom, as we mentioned before, you should wear a well-fitting mask. So at minimum, a surgical mask, and preferably if you have a K95, that's what you would wear sort of in your common spaces. So after 5 days of home isolation, so 5 days is kind of thought where you're most infectious. And so after 5 days, assuming that you don't have a fever for 24 hours and that your symptoms, if you have any, are resolving, you can then leave home isolation and sort of go out into the public. But what I mean by that is, we really don't recommend for you to go to crowded places. We don't recommend that you go to parties or sporting events right after 5 days. It really is meant to do essential tasks. So if you have to go to work, if you have to do groceries, things of that nature. And when you're out in the public, we do recommend, again, that you wear a well-fitting mask. That would be things, again, including a surgical mask or K95 mask. We would avoid that if you have, events that you have to attend that are big events, don't attend them for 10 days after your symptoms have started or if you have a positive COVID test. I think those are kind of the big guidelines. Again, and the other thing would be, let's say after 5 days, you're not feeling well, you really feel the same. You should really keep isolating, right, until you start feeling better. And so really after 5 days, if you're still feeling pretty crummy, you should still stay at home and self-isolate. If you keep having a fever, then you should also, not continue to home isolate. And also after 5 days, if you're not feeling well, I would recommend that you call your primary care doctor to kind of make sure that there's nothing else going on. There's a couple things that they could recommend. As I mentioned, there's some oral therapeutics, oral antivirals that could be prescribed for folks who are at highest risk. So that would be like folks that are over the age of 75, who are unvaccinated or not fully maximally vaccinated, as well as those 65, 74 with pre-existing conditions, and those over the age of 18 with very severe or moderate or severe immunocompromising conditions. So those are all sort of treatments that you can actually receive if you sort of meet any of those categories. And I should say that if you do meet any of those categories, rather than waiting until day 5, you should call your primary care doctor right away because they might be available to you sort of sooner rather than later.
Excellent. So then what do you do if you are exposed to someone with COVID?
Yeah, so as I mentioned, so isolation means keeping sick people away from healthy people, right? Quarantining means keeping people away, healthy people away from healthy people, right? But what quarantine really means is sort of this idea of a risk, right? Risk assessment, right? So because of the level of transmission, right? This is one of the reasons we put out the advisory. Essentially, if you step out your door, you're going to be at some level of risk, right? Just because there's a lot of sick people around, right? But there are some people that are higher risk, right? So if you've been exposed to somebody, let's say somebody in your family has come down with COVID, a coworker, a classmate. So those encounters, those close contacts put you at higher risk, right? And so if you're at higher risk, what it means is that there's a better chance or a higher chance you're going to develop COVID-19, right? So in order to keep others around you safe, it's sort of, we'd recommend a quarantine, right? So even though you're not sick, you're at higher risk of becoming sick. And so we want to keep you away from other folks who are at lower risk from getting sick, right? And so the recommendation would be that if you are exposed and you are vaccinated, then we still would recommend, again, avoid big crowds, avoid big gatherings, wear a well-fitting mask, and get tested at day 5. But you don't have to stay at home, right? The thought is that the vaccines are pretty protective, and with additional layers, it becomes more protective. If you are not fully maximally vaccinated or unvaccinated, we would recommend that you self-quarantine at home for 5 days. At day 5, if possible, we would recommend that you get a test, either a rapid antigen test or a PCR test. And if those are negative, then you can end your self-quarantine period. But regardless, you should still wear a well-fitting mask, and you should avoid big crowds until about 10 days afterwards. At 10 days, the risk is reduced substantially, and the risk to others, I should say.
And
Okay, so I see. Oh, sorry. Go ahead.
Sorry, I was just going to add that what Dr. Marquez covered so well is also available on our website. We have a great resource. What if you test positive? And it really even includes a calendar to help you look at, when you started with those symptoms or when you tested positive, to make sure that you're counting days appropriately. So that resource, and I'm sure it's being put in the chat, but that, or on the Facebook information, but that's available on our website in English and Spanish.
Thank you, Jimena. I like to plug the website as much as I can because there are just a ton of fantastic resources there. So this next one I hear a lot. What should I do if I have COVID symptoms? Now, some of those symptoms might indicate other things, so people aren't always necessarily sure what they should do.
Yeah, so if you have COVID symptoms, I think, regardless if it's sorry, our time-saving lights here don't, keep turning off. Whether you have, if you have COVID-like symptoms, it could be COVID, it could be the flu, it could be, a bad cold, right? Regardless, those are, even though if it's not COVID, those are still transmissible to others and still can get others sick. And so regardless of what you have, if you have symptoms, meaning fever, cough, shortness of breath, sort of like new onset headache, new onset sort of diarrhea or vomit, nausea, vomiting, all of these things that could be COVID symptoms, it could also be other things as well. So what we would recommend is, if you have any of those symptoms, certainly stay at home, so stay away from others, and isolate, right? So after that, we would recommend calling your primary care doctor just to make sure that, see if there's any additional recommendations. They may ask you, or you might decide to get tested, right? And if you get tested, you should certainly continue to isolate until you've been gotten your test back, right? If your COVID test is negative, it doesn't mean that you're healthy, right? You still have symptoms. And so again, it could be flu, it could be something else. And so we would recommend that you stay at home until those symptoms resolve. And if you test positive for COVID, again, that's sort of the longer period that we would recommend staying at home, just because it's a little bit longer window that you can get other folks sick. The other thing I will say is that, if you have flu-like symptoms and you get a test and it's negative, I would actually encourage you to call your primary care doctor, because there's actually, you could have the flu and they could test you for the flu, but even with those types of symptoms, especially if you're high risk, there's actually medication to prevent you from getting very, very sick, much like there's medication for COVID. And so just because you don't have COVID doesn't mean that you're okay to kind of go out and about. You should still contact your primary care doctor in case there's other medication that you can take to kind of prevent you from getting very, very sick. I will just put in a plug that, or not a plug, but we're still flu season right now, right? And so last year we had a very mild flu season. We don't think that's going to be the case this year, right? And so, flu can be very, very serious, especially if you're very old, very young, or very sick, right? And so, even if you don't have COVID, you may have the flu, and so you got to make sure you take care of yourself if you have flu-like symptoms.
Excellent. All right, we're going to turn now to vaccines and boosters. I'm sure people have a lot of questions about this. All right, so who should get a booster dose and why are boosters important? Now, in answering this, I hope you can add a little bit more context, because there are terms like fully vaccinated and maximally vaccinated and boosted. What does all this mean for people that have questions?
Yep, so essentially everybody over the age of 12 should get a booster as soon as they're eligible, right? So it's gonna be 5 months after your second dose of Moderna and Pfizer, and 2 months if you got initial dose of J&J. Now, I understand that there's been different guidelines that have been put forth about vaccination, and I will say that the messaging, right, from our public health everybody may have not been perfect, but the reason for change is because of evolving science, right? So, in this pandemic, we've had the great fortune of having a very rapidly deployed vaccine that is only really possible because of modern medicine, right? But along with that sort of rapidly deployed vaccine is an opportunity for learning right along the way. And I think that we would be doing everybody a disservice if we didn't change guidelines as new data, new information is discovered, right? And so initially the thought was, if you had 2 doses of vaccine of Pfizer, Moderna, or 1 dose of J&J, it was very protective against the current variant that was at the time, right? So we then saw that there was a new variant, which was Delta, right? And so really the recommendation for a booster was to basically rev up your immune system to fight against Delta. Now we have another variant, which is, as Jimena mentioned, more transmissible. So it's more likely to be, it's more infectious, right? And the booster becomes, I would say, just as important against this variant so that we prevent, sort of 2 things. One is sort of reduce symptoms, reduce, sort of the symptoms that we have that are mild. But I'd say the most important part is really to prevent severe illness and including hospitalization and death, right? And so the importance of the booster is really to sort of amp up your immune system against these evolving variants, previously Delta and now Omicron, right? And so it is really, again, and this is regardless of your underlying health conditions, you should get a booster. If you are older or you have sort of comorbidities, including things like, sort of being a little bit overweight, obese, diabetes, having heart problems, having kidney problems, it becomes even more important for you to get a booster because those sort of comorbidities put you at greater risk of having very severe outcomes from a COVID infection. And so it becomes, again, important for everybody, but especially if you have these underlying comorbidities, because we want to make sure we keep you out of the hospital and keep you from having severe outcomes.
All right, thank you. So how about for our viewers out there that are big fans of the vaccine and the booster, and they've already gotten one, can they get another one?
So unfortunately, the current answer is no.
Right.
There are, for those who have moderate or severe immune compromising conditions, so that would be, for example, if you're taking certain medications that reduce your immune system, you're having sort of treatment for maybe like a disease like cancer, or you have other sort of immunocompromising conditions. It's really found that you should have 3 doses as your primary series and then a booster. So it gets a little bit complicated, but in a very small subset of folks that have really sort of severely reduced immune systems, they end up getting sort of 4 doses. But for the vast majority of people, it would just be a sort of 2 doses and a booster.
And I would just add, people have probably seen this process happen multiple times now that the vaccines have become available. But typically what you see is the FDA approving vaccines for certain ages, boosters, and then the CDC and their immunization committee meets to give further approval. So we work only under those approvals, and at this point, there's no sort of CDC, if I'm correct, Dr. Marquez, no CDC approval for additional boosters at this time.
Correct. Yep.
Yeah.
Oh, sorry.
I was going to ask too. So I think some people may be confused if they got J&J, which was supposed to be the one and done. They're not going to necessarily get a 3-shot series, right?
Exactly. Yep. So if you got J&J, you'll get 1 additional booster, and so so it'd be a total of maybe 2 vaccines for those with J&J. Exactly. But what I was going to say is that we're talking about extra doses. But if you have not gotten your booster, we very, very strongly encourage you to make your appointment as soon as you can.
Excellent. Okay. We're going to turn to testing now. So are free rapid test kits available in Washtenaw County?
So unfortunately, we're seeing not just in Washtenaw County and the state of Michigan, but it's happening across the country. We're seeing a real limited supply of over-the-counter home test kits. And so certainly we have been trying to procure as many as possible and also work in collaboration with the state to have as many available. But we currently have a very limited supply. We're prioritizing really distributing those to people, first of all, who have had an exposure to COVID and who really have difficulty accessing some of the existing testing sites or have other needs. So the limited home test kits that we have is pretty targeted in terms of its distribution, but certainly we're always working to secure more of a supply, and hopefully as that supply increases, we'll be able to have them more widely available. But of course, many people also saw today that the federal government has started a website where every person can go and order, I want to say it's each household can order 4 free rapid tests that will get delivered to you free of charge. And so that information will be shared by our staff in the chat as well. So you can go to the website and order up to 4 free test kits.
Excellent.
I think the other piece, if I'm not incorrect, I think that if you do have medical insurance, your insurers are also now required to cover at-home rapid antigen tests. So even though it might be difficult to still find the stores, when you do, they should be actually reimbursed by your medical insurance company.
Yeah, thanks for adding that. And if you have questions about that process, the best thing is if you do have insurance to reach out to your insurance company.
So it sounds like as supply becomes more available, it should be much more accessible to people as we move forward. Okay. So if you get exposed to COVID, when should you take a test?
Yeah, so what we would recommend is that if you get exposed, that you wait about 5 days before you take a test to allow for any sort of COVID disease to actually manifest itself and be picked up by a rapid antigen or by a PCR test, right? So if you do have a few tests at home, so let's say that you are, you go to the store, you find maybe you buy a couple kits that you happen to pick up, then we would typically recommend sort of a little bit more frequent testing. So let's say day 5 and day 7, and then maybe day 10, right? So if you have one test, you would probably recommend day 5. If you have a few tests, start testing, around day 5, and you can test sort of every other day through day 10.
So with the different kinds of tests out there, I think there's been some confusion about how they each work. So if you take a rapid test that comes back positive, can you trust that result, or do you need to get a different kind of test?
Yeah, so that's a good question. So typically, like our recommendation is that if you are exposed or you have sort of COVID-like symptoms and you get a positive test, you should really trust that test. The pretest probability is actually very high. If there's a situation where for example, you don't go anywhere, you don't see anybody, you bought a test that came mailed to you, and you test positive, and that's a situation where you might want to get a confirmatory test. The other situation where we sort of get another test is if you're living with a lot of people, so in the congregate setting, and it might impact a lot of folks. In those cases, we may get a confirmatory test just to make sure that we're doing the right thing from a public health standpoint. But by and large, for the majority of people who are either exposed because of their day-to-day activities or they're having symptoms, it's a pretty good test, and you should trust a positive test.
Okay, so sticking with rapid tests, how do I report rapid test results to the health department, or do I even do that?
So we're not collecting that information right now. There's no need to report it to the health department. At this point, we we are really trying to focus and with the limitations we have, really focus on those cases that are reported to us because they're required to be reported. So people who get tested through a pharmacy, through a doctor's office, through other testing locations like urgent care centers, all of those tests get reported to the health department. And at this point, we're processing and reporting out between 800 to over 1,000 cases each day. So you can imagine the volume that we have to go through. So that's why it's really important. We want to make sure that we have accessible information in multiple languages that will help people understand what to do should they test positive. And of course, if you have questions, you can call the health department, you can call 211. And if you have a physician, you certainly can call your physician as well. But really important, that's why I reiterate the resources that we have available on our website, that information to help you through that process of understanding what to do if you test positive or have been exposed.
Excellent. Okay, so we're going to turn now to treatment. So people have been hearing a lot more about monoclonal antibody therapy. Why is it so limited in Washtenaw County?
Yeah, so it's actually limited across the nation, right? So I think what's happening in Washtenaw County is just a sort of a example of what's happening across the state and across really the entire U.S. So so there are essentially 3 FDA authorized so 3 FDA authorized monoclonal antibody treatments, right? And so those 3 were all effective against Delta. Now, with the rise of Omicron, of the 3, there's only 1 that's actually effective, and it's the newest one. So there's been severe shortages really across, not just Washtenaw, but across all the state, across the U.S. The hope is really that there is going to be sort of as sort of manufacturing picks up, that we'll have more and more of this particular monoclonal antibody, but it's going to take some time for it to ramp up. Similarly, with the oral therapeutics, there's a couple that are available. There's very, very limited supplies that are available right now, and so it's just going to take a little bit of time for those to also ramp up. But as I mentioned, if you are at high risk, kind of what I mentioned before, but let me just repeat. So let's say that you are over the age of 75 and not fully vaccinated. You're between the ages of 65 through 74, and with one or more comorbidities such as obesity, diabetes, heart disease, kidney problems with your kidney, or if you have severe or moderate to severe immunocompromised condition over the age of 18, all of those will qualify you for some sort of treatment, right? So if you test positive, call your primary care doctor, talk to them about what is available for you, it may be a bit limited, but for those conditions that I described, really that's where it's prioritized for those folks at this time.
And I just have to give a shout out to Dr. Marquez here because at the end of 2021, he worked very hard to establish additional monoclonal antibody therapy available through the health department in collaboration with St. Joe's, really because part of what we want to ensure we're doing, particularly during a surge like we're experiencing, is relieving the capacity on our healthcare systems. And so we were able to provide that for a short period of time. Unfortunately, the medication that was being used is not effective against Omicron, but we certainly hope that as other therapies become available, the health department can continue to play a role in really ensuring access to those medications and alleviating the strain that our healthcare systems are feeling. So certainly the health department is doing what it can to ensure that we have that we're helping people get access to those therapeutics.
Okay, so now we're going to turn to some questions from our residents that really like to dig into the data on the health department website, which there's a lot of it. So first, have you found any evidence of transmission linked to U of M football game attendance? We get that one a lot.
Yeah, no, we had a lot of questions about that as football season started, and certainly understand people's concerns. We actually have not had data that shows any increase in cases or outbreaks associated with football games. And I think, obviously importantly, those games were outdoors. And so again, the importance of ventilation and outdoor events being safer than others. And I know that people think, well, it was a lot of people being, crowded together into that stadium. But we have, and while people come from other counties in general, in Washtenaw County, we have high vaccination rates. The University of Michigan has a vaccine requirement for its students, staff, and faculty. And also any of the indoor areas around the stadium, you had to wear a mask. So whether you were using a restroom or you were in one of the indoor areas around the football stadium, at the MDen store, wherever, you had to have your mask on. So again, the importance of those layered prevention strategies. But no, we did not see significant outbreaks or increase in cases connected to the football games. And Dr. Marquez, I don't know if you want to add anything there. But we did, that's a good question, because we did get a lot of those questions, especially early on in the football season.
No, I think the answer is great.
It was a thorough answer. Thank you, Matt. So if we're looking at the data around COVID hospitalizations on the website, so are those patients that are there for other reasons and then they got a COVID test and they tested positive, or are they there in the hospital because they had already, because of COVID?
Yeah, so that's a great question. So for the data that we actually have on our website, so we have an epidemiology team that works really, really hard to sort of clean the data, to go through the data, make sure that it's as accurate as possible. And so for the hospitalized cases that we put there, they really dug through the charts and made sure that it's the reason that they were at the hospital is related to COVID. And so it's, it is preliminary, so it may it may change when we find more information. But as far as we sort of have right now, it's really COVID-related hospitalizations, which is, it's a great question, because again, the COVID is so sort of widespread that some of the estimates on other states, so for example, New York City, the estimate is that some hospitals, 2/3 of patients admitted for all reasons have COVID, right? And so I think across New York City is about 50%. So it's a really good question, but I think that the data we have is pretty, it has been cleaned up pretty well.
All right. So here's a very specific question. So back in October, the website shared that unvaccinated people had 4.3 times the risk of testing positive and 13.2 times the risk of dying from COVID compared to people who were fully vaccinated. This is pre-Omicron. Are there updated numbers based on the new variant?
So we're not yet. So we are waiting for an update from some of the state data. It takes a little, so there's a little bit of lag, right? In both in sort of case data, then hospitalization data, and sort of severe data like death. And so there's a lag both in sort of the natural progression of each of them, but also a lag in sort of the reporting. So it takes a little bit of time. And we've only really had an Omicron surge here locally for, three and a half weeks. So it's going to take a little time until we get that data sort of analyzed.
And one thing that I would add also is that, that health systems often share data around their hospitalizations and what they're seeing in terms of people who are up to date on their vaccinations or not vaccinated. And so I know that, for example, Michigan Medicine regularly provides updates in terms of the hospitalizations broken down by people who are up to date on their vaccinations, people who are not vaccinated, as well as how many are in the ICUs. And sometimes I think they include how many people are on ventilators. So that information is shared by our health systems. I've seen that updated regularly through Michigan Medicine. So that's another way that you can look at kind of what we're seeing in our hospitals.
I think that collaboration with the health systems may be one of the reasons why the health department's catchphrase is healthy together, right? Okay, so we're going to turn to prevention now. People have heard a lot about public health orders. So what is required right now by public health orders?
So right now, we have two local public health orders that are in place and still effective. So they are both for K through 12 educational settings. One is the requirement for wearing masks. That includes for students, staff, visitors, anyone inside buildings, K through 12 educational buildings. And the other is isolation and quarantine order, which was actually just recently updated to reflect the updated CDC and state guidance. So those are the only two orders that are in place. Those also are available on our website. And as I mentioned, the most recent update was made to the isolation and quarantine order.
All right. So this one is a really clear question, but it might be a complicated answer. What should people be doing right now to stay safe?
Yeah, I mean, I think, there's no single thing, right, there's no one thing that people can do, right? So I think all along the pandemic, there's been multiple layered approaches that were taken, right? So there's many things that people should be doing right now to stay safe, right? So if you look at across the board, probably the most effective tool at this point is really vaccination, right? So if you are eligible to be vaccinated, the best thing you could do for yourself and your family and those around you is really to be vaccinated. But as we talked about, even somebody who's fully vaccinated may have a breakthrough case, right? And so even if you're vaccinated, you should be wearing a well-fitting mask. Again, that we've recommended an upgrade from a cloth mask to either a surgical or K95 mask. And then, physical distancing, so staying, 6+ feet away from other folks. If you're going to a crowded event, maybe think about postponing that, right? Maybe you kind of wait until it gets less crowded. So for example, there's a crowded store, crowded restaurant, maybe you wait until there's less people. If testing is available, using screening testing, right? So if you've been exposed, then being tested to see if you developed an asymptomatic infection. Ventilation is really important. So especially if you're sort of in a place with other folks, making sure, and if especially if, let's say you either own a business or sort of are able to manage some of the ventilation, that's also like a very important piece. But just as an easy example, if you have friends coming over, and I know it's cold, but you can tolerate a little bit of, a little cold, opening a couple windows, at least a few cracks, actually improves ventilation quite a bit. Making sure you wash your hands, and if you're coughing, that you cough into the sleeve of your elbow. If you do get sick, really staying home when you're sick, and then, getting tested again for COVID and other respiratory illnesses. If you do develop COVID, reaching out to those who you've been around the last 2 days before you got ill, making sure they know that they might have been exposed, and then providing, and so that they know to get tested if appropriate, and then really just clean disinfect. So these are all layers that have been really advocated by CDC, MDHS, and here at Washtenaw County. And so they're all, there's no different approaches. Really, doing all of those will keep one safe.
Excellent. Okay, so I am hopeful that we have some business and nonprofit and other organizational leaders watching right now. What suggestions would you have for them on how to keep others safe?
Do you want to? Oh, I'll start. We obviously during this time of COVID have worked really closely with many organizations and businesses and restaurants to really ensure that they're doing everything they can to when they were able to be open as safely as possible and keep their employees safe. So certainly take to heart the recommendations that we provide as the local health department. If businesses can require masks, that would certainly be one step to ensure that everyone is wearing a mask when they're in an indoor public space. also making sure that employees are able to take the time they need for isolation and quarantine so that we're really protecting the workplace and encouraging employees not to come to work if they're not feeling well, trying to help connect employees to testing, even if there's an ability to provide, cover the cost of testing or provide home test kits. Those are all things that employers can do. And of course, we're a resource if there are any questions or situations where additional guidance is needed. I think the other thing too is really think about, the number of people that are indoors at any one time. And certainly if there's any ability to allow people to work remotely, especially in times like this, when we're having a surge, that's certainly something that employers can think about as well.
Yeah, and I think the other thing I would echo is that, again, this is, this is kind of what I said before, there's not one strategy, right? So there's a multiple strategies that should be layered on. And if a business or an organization or, an entity thinks that, hey, I can't do, X, Y, or Z, right? So there's opportunity to do other alternatives, right? So I will give you an example. So if you have an organization where physical distancing is just not possible because of the nature of the work, right? That's a strategy that you can't do, right? But there's 9 other strategies you can do, right? So you try to compensate for that by doing something else. So for example, we're providing well-fitting masks for the employees, right? Providing testing. So maybe there's an opportunity to work with a testing vendor to test folks on a regular basis, right? Let's say that, for example, that you just maybe one of the businesses really can't do a 10-day quarantine, right? Because of in order to have operations function, again, you have other opportunities. You increase ventilation, right? You increase opportunity, wearing masks. As Jimena said, maybe if somebody does get sick, they immediately go get tested. So it's not just one strategy that you do. There's multiple strategies to keep folks safe, and it's just this. I think understanding that there's an opportunity to kind of sort of figure out the best strategy might work for your particular sort of organization or business. What I will say is that if you can't do one, it's really, if you can't do a strategy, it's what I would say not to do is to just give up. I can't do it, right? Sorry, I can't quarantine folks, or folks have to come work. I'm not going to do anything, right? It's really the idea that if you don't do one, you can sort of compensate by doing another one.
So sticking on the topic of businesses, returning to Facebook Live questions, how are businesses increasing air ventilation during the winter months? Can either of you answer that?
Yeah, so I think it depends on the business. Some have been very proactive, and I think have installed, from my understanding, have installed sort of whole sort of unit sort of air purifiers, right? Other businesses have really, at the very least, changed the kind of filtration they do. And then other businesses that it's just hard to do, simply open a window and then have a heater going, right? So there's I think there's ample opportunities to increase ventilation, even if you don't have an unlimited budget.
All right. Another question here from Facebook Live. What metric or objective will you use to end the mask mandate in schools?
So our order does talk about that metric being related to community transmission levels. And so that's what's currently in the order, although we regularly evaluate and review the data that we have. And certainly that's something that we are considering in terms of other metrics that we may look at, for example, vaccination rates or other kinds of metrics that really have changed over time. And so currently it's based on community transmission, but that certainly could change based on the review and updated data that we have as time goes on.
Okay. Another question here from Facebook Live. It's a very direct question. So when will you admit that COVID isn't going anywhere and it's just a virus that we all need to learn to live with, like the flu and the common cold?
So I think that it's a good question, right? I think that's a fair comment, right? And I think that what I would say is that so we're gonna have to learn to live with it, right? So I think that actually the poster and the commenter is like 100% right. We have to learn how to live with it, right? But learning how to live with something is not ignoring it, right? So it's very different than ignoring it, right? So so learning to live with something is like, again, we have 10 layers that we can choose from. Which ones can we accomplish and which ones can we not, right? And so I think one of the parts of learning to live with something is really sort of understanding what adaptations we may have to make in order to sort of kind of make sure that our hospitals are not over capacity, right? So right now, if we were to say that it's just endemic, there's not a problem, that would be a false statement, right? Our hospitals right now are close to 100% essentially, and the thought is that really we even really haven't hit peak flu season, right? So I think that really for the next 4 to 6 weeks, just between flu and between COVID, our hospitals are really going to be very much stretched. And I think that that affects not just folks who go into the hospital for COVID-related illnesses, but if you are riding a bike and you fall off, you may not be sort of treating the ED for many hours. If you have a heart attack, you might be diverted from 2 or 3 hospitals before you can actually find one. So actually, it impacts us even if we don't go in for COVID-related illnesses. And so I think that when we think about sort of living with in the future, I would agree. And I think that really we have to start focusing on sort of like measures of severity, so things like hospitalizations, but we're just not there yet. So if I were to use that metric and say we're going to really focus on hospitalizations, we're at like 100% capacity in our hospitals, right? So even by that sort of metric, we actually are not sort of under really controlling transmission of COVID right now. So I would agree. I think it's something we're working towards, but I just don't think we're there yet.
All right. All right. Well, we have reached the end of the questions and the end of our time here together. I want to thank you, Jimena and Juan, for taking time out of your evenings to share your expertise. And I want to thank the health department staff that are working behind the scenes to make all of this work on Facebook Live, and for the work that everyone at the health department does every single day. This is, the third winter of the pandemic, and the health department has been working tirelessly. And I thank them for the great work that they're doing. And I want to thank everybody for tuning in and for asking such good questions. Please share the video with others. It's important that we get this information out there. There's a lot of misinformation out there. So the best way to combat that is for us to get accurate information to people. So please share the video. It'll stay up. That's why we did it. And I want to remind people, if you haven't seen it on Facebook already, we're going to be doing another one of these on Thursday this week at 7 p.m. and it'll be in Spanish. So tune in and spread the word about it. The latest updates on the pandemic and lots more information can be found on the website, as well as social media and email updates. You can sign up for email alerts from the health department. So that's all we have for tonight. Thank you all for tuning in.
Thanks, everyone. Good night.
Okay, thank you.